Okay, good morning to all of my dear viewers. So in today's session we are going to discuss a very important topics of community medicine and also it will a part of medicine. The name of topic is cancer. So without any delay we can start the topics. So first we try to understand what is the meaning of cancer. So cancer means whenever there is a neoplastic transformation will occurs. Whenever there is neoplastic transformation will occurs in any tissue of your body, the such tissue will change into the cancerous cells. So what happens? Whenever any body cells undergoes neoplastic transformation, so as a result of this neoplastic transformation, this body cell change into the cancerous cells. So what are the characteristics of these cancer cells? One of the common characteristics of these cancer cells, they are immortal in nature. What? They are immortal in nature. Normally cells are mortal in nature, but these cancer cells are the immortal in nature. And also they lost the ability of contact inhibition. Normally what happens, whenever the cell grow with a fixed number of times, and after the fixed number of times divisions, they will undergo apoptosis, I mean programmed cell death. But these cancer cells are the immortal in nature. They start their division continuously and they also not follow the contact inhibition properties. Normally what happens, when a cell is grow and the surrounding cells are come in contact, then they stop their progression or their growth. But this cancerous cells, they lost the property of contact inhibition and they start invading the surrounding tissue. One thing is that they start invading the surrounding tissue, and another things that after a certain when the mass of the cell will increase in size, they start metastasis. I mean they start moving from one place to another place, or we can say that they start changing their location. So this condition is called metastasis. So metastasis is one of the characteristics feature of cancer. Okay, so we can classify cancer into some different criteria. One of the common cancer is the carcinoma. So when we called a cancer is a carcinoma, when cancer is originated from the epithelial tissue, such cancer we called as a carcinoma. When we called a cancer as a sarcoma, when cancer cells is arises from the connective tissue or a tissue which is arises from the mesodermal tissue, I mean cells which are mesodermal in origins. So if the cells which are mesodermal in origin and they undergoes neoplastic transformation, so such cancer is called sarcoma. If cancer cell is arise from the epithelial tissue, we call it as a carcinoma. If cancer cell is arises from the cells which are mesodermal in origin, we call it as a sarcoma. Two or three more types of the cancer. One we called as lymphoma, multiple myeloma, and the leukemia. So what are the difference between in all these different types of the cancers? When we called lymphoma, so what is the meaning of the lymphoma? Lymphoma means the cancer cell is arises from the lymphoid tissue. And what is the meaning of this lymphoid tissue? Lymphoid tissue means the tissue of tonsils, tissue of a spleen, tissue of lymph nodes. So here what happens? The B and T lymphocytes, they undergo neoplastic transformation. So when B and T lymphocytes of the lymph nodes, they undergo neoplastic transformation, they show a specific characteristic nature. What is this specific characteristics nature? This specific characteristics nature is that they form basically they having a cohesive nature. So due to the cohesive nature, the surrounding cancer cell, they start sticking with each other. So when the surrounding cancer cell start sticking with each other, they form a mass of cancerous cells. So in case of lymphoma, we observe a mass of cancerous cells. So whenever during the examination or during the investigation you observe the mass of B or T lymphocytes, we suspect it as a lymphoma. Okay. So what is the meaning of leukemia? In case of leukemia, the neoplastic transformation occur in myeloid or lymphoid lineage in a bone marrow. So basically leukemia is a cancer of bone marrow. So in bone marrow, when the precursor of WBC and the RBC, they undergoes a neoplastic transformation, we called it as a leukemia. And how we can differentiate this leukemia from the lymphoma? Because sometimes what happen, the tissue, neoplastic cells which is originated from the bone marrow, they start infiltrating the lymphoid organs, and also the cells which undergoes neoplastic transformation in lymphoid tissue, they also start infiltrating the bone marrow. So how we can differentiate cancer is lymphoma or the leukemia? So the common things that observed during the study is the lymphoma form a mass of tumor cells due to their cohesive nature. But this leukemia, they having no any cohesive nature. So if they having no cohesive nature, so they no form a mass of tumor cells. So on the basics of mass of tumor cell, we can differentiate it. Cancer is lymphoma or the leukemia. The one more common types of the cancer is multiple myeloma. So this multiple myeloma is basically the cancer of plasma cells. Or what is this plasma cell? Plasma cell is a mature B lymphocytes. So what happens if plasma cell undergoes neoplastic transformation, we call it as a multiple myeloma. So this all about the different types of the cancer cells. So now we are going to read whatever written on the boards. So cancer, it is characterized by abnormal growth. Why we called it as abnormal growth? Because they lost the ability of contact inhibition, they become immortals, so which is abnormal in nature. So that's why the cancer cell, we call it as abnormal growth of the cells who having invade the adjacent tissue. Due to the rapid proliferation, it can invade the adjacent tissue, and even a distant organ, we call it as a metastasis, and finally lead to the death of person. What happens? These cancer cells are the immature cells or non-functional cells. So if in our body there is high number of non-functional cells, so what are their use? So if in our body there is the high number of non-usable cells, so all the vital activity of our body gets suppressed, and finally a person will die. So we can categorize cancer into the different criteria. Carcinoma means cancer arise from the epithelial tissue. Sarcoma means cancer of connective tissue, basically cells which is arise from mesodermal origin. Lymphoma means cancer of lymphocyte, especially B and T lymphocytes, which is arise from the lymphoidal tissues like lymph node, spleen, tonsils, and these cancers show a cohesive natures. So due to they stick with each other to form a solid mass of cancer cells. So this is all about the lymphoma. What is leukemia? Cancer arise due to the neoplastic transformation occur in a myeloid or lymphoid lineage, which is the precursor of WBC and RBC in bone marrow, and they not show the cohesive nature which is used to differentiate the leukemia from the lymphoma. Okay. Multiple myeloma means it is the cancer of plasma cells. So this is all about the different types of cancer. So after discussion the different types of cancer or the different categories of the cancer, now we move towards the cause of cancer. So in a study it is observed that environmental cause is the most common cause of cancer, and the environmental cause, they are the two risk factor. One is the smoking and the tobacco. So tobacco, it can contribute the 80 to 19% of the cancer, and Some other risks, some other factors like dietary factors. So in dietary factor, the high fat diets cause breast cancer, a smoked fish cause a stomach cancer, beef consumption bowel cancers, and occupational exposure like the benzene, arsenic, cadmium, chromium, vinyl chlorides, asbestos cause variety of the cancer. Virus like hepatocellular carcinoma, HIV infection cause Kaposi sarcoma, which is the early manifestation of HIV infection, and a non-Hodgkin lymphoma, which is the late manifestation of HIV infection. Epstein-Barr virus cause Burkitt lymphoma. Human papilloma virus cause cervix cancer. Cytomegalovirus virus cause Kaposi sarcoma, and the genetic factor it cause the retinoblastoma. Okay, so whatever. There are different factors like environmental factors. So environmental factor contribute 80 to 19% of the cancer, and in environmental factor the most common cause of cancer is due to the tobacco, either in form of chewing or in case of the smoking. So due to the tobacco chewing and smoking, it will contribute 80 to 19% of all the cancers. Dietary fibers like high cholesterol diets and beef consumption of a smoked fish, they also contribute in cancers. Like if we consume the beef, we can increase the risk of bowel cancer. A smoked fish increase the risk of stomach cancer, and the high fat diet increase the risk of breast cancer. Some viruses are also associated with it, which are responsible for the cancers, like the hepatitis B virus, hepatitis C virus. It will cause the hepatocellular carcinoma. In case of HIV infection, it will cause the Kaposi sarcoma, and Epstein-Barr virus, they cause Burkitt lymphoma. Human papilloma virus cause cervix cancer. Cytomegalovirus virus cause Kaposi sarcoma. Genetics factor, they also contributes for the development of cancer like retinoblastoma, and it is observed that Mongol who are more likely to developments of leukemia than the other children. So this is all about the cancer, their categories, and what risk factor or okay, it's fine.